I learned that the business model of drug companies is organized crime.
Why do you call them organized crime?
Every type of person that can be bribed has been bribed. FDA commissioners, the top guys at the FDA, and even ministers of health.
How did they get away with it?
The corruption is huge in America. The drug industry has been convicted of more crimes than other industries. I found out that they had committed serious crimes repeatedly.
The trust in a lot of institutions went down. The trust in the U.S. government, down. The trust in mainstream media, down. The trust in doctors, down. The trust in CDC, down. The trust in World Health Organization, down.
Don't compare me with the CDC. It is actually the most corrupt of all industries.
Where are you getting that data from? All right, so we have Dr. Peter Gøtzsche with us, the author of Deadly Medicines and Organized Crime, How Big Pharma has Corrupted the Healthcare Industry. And he's also got a new book coming out called How Merck and Drug Regulators Hid Serious Harm of the HPV Vaccine. Dr. Gøtzsche, it's great to have you on the podcast.
Thank you.
So, you know, the more I read into you and the more interviews I watch of you, you're a whistleblower from 2000, from early days. You know, a lot of times during COVID, we saw a lot of new doctors coming out and what they were saying, and they were blowing the whistle. But you've been doing this for a minute, and your background started off of, you know, a master in science and in biology, chemistry in 1974. And then you go work in the industry. You actually sell some of the products in Big Pharma. Then you go become a doctor. And then later on, you see what's going on, and you kind of start blowing the whistle saying, wait a minute, let's take a time out. I don't think we're going the right direction here. So if you don't mind, what prompted me wanting to do this interview with you is a few weeks ago, I was at a show called Jubilee where 20 kids are sitting next to me, around me, and they're debating me on different topics. And one of the girls said something about that she's mentally ill. And when I asked her, who told you you're mentally ill? She said herself and her team of doctors. And I kind of want to go into that space. I'll show you the clip here in a minute, but before we get started with that, if you don't mind taking a minute or two and just kind of share with the audience your background, that'd be great.
As you say, I became a biologist at first and didn't know what to do. So my grandfather, who was a doctor, suggested I went into the drug industry. And I hadn't been there for long before I realized that these people were cheating on the doctors. So I couldn't stay there. So I took the worst way out by taking a whole new education, becoming a doctor, while I still worked in the drug industry. So that was pretty hard, but that's what I did.
Got it. And so when you got in, how much longer after you got in, you learned about, you know, how it had become a business and what they were doing maybe wasn't the best solution. It was more of a business than an actual solution for the patient.
Well, I have always asked questions since I was a little boy. And even though I was a biologist and didn't know much about drugs, it didn't take me long before I found out that the clinical trials had been manipulated and what salespeople were telling doctors were not correct. It was pretty easy to find this out, actually.
So what did you learn?
Well, some years later, as you say, I wrote this book about organized crime. So I learned that the business model of drug companies is organized crime. I wasn't allowed to use this term when I published an article in the British Medical Journal because they are so afraid that they might be sued by Big Pharma, so they called it corporate crime, but it's far worse than this. It is organized crime according to US law. That is their business model.
Unpack that for me, because that's a strong statement, and I've seen you in other videos, but maybe for some people that haven't heard it, why do you call them organized crime?
Oh, it's pretty simple, really. I went out on the internet and I Googled the 10 biggest drug companies in the world, and I found out that they had committed serious crimes repeatedly and had been fined sometimes billions of dollars. But it's a tiny bit actually compared to what they earned by their crimes. which is why the crimes just continue. And according to US law, the Racketeering Act, organized crime is about doing things repeatedly, which can be fraud, and that is all over the place, both in research and marketing, bribery, political corruption, obstruction of justice, embezzlement. So these are things that you can see the big pharma companies do all the time.
How do they get away with it? If that's what they do, how do they get away with it?
Well, now I'm talking to an American. I will tell you that's pretty obvious, actually. The big pharma companies, they bribe your politicians, both Republicans and Democrats. And it's therefore very difficult to do something effectively against the organized crime.
It's very difficult to do anything with them, with the organized crime. Okay, so Dr. Gøtzsche, if you don't mind going a little bit deeper, because right now, like, I want the audience, I've seen you speak eloquently with getting into details of what things you found. This is surface level. Would you mind getting a little bit deeper for the audience to understand what you're saying?
Yes. For example, I wrote in my book that virtually every type of person that can be bribed has been bribed, including FDA commissioners, the top guys at the FDA, and even ministers of health. So it is very widespread to bribe people. And of course, doctors are some of those who are bribed the most. And if you work in the industry, you start by buying the top doctors, the professors and department chairs. So when you look at how much money these people earn in the United States by being on a drug company's advisory board or whatever they do, these are obscene amounts according to European standards. So the corruption is huge in America. It is actually the most corrupt of all industries. It even supersedes big oil and other industries. So the drug industry has been convicted of more crimes and more serious crimes than other industries. And this is absurd because they are dealing with our survival, our health. So it shouldn't be that way.
Okay, so how different is it, the way big pharma can get away with things? Because while you're saying these, we know these numbers. I mean, I'll pull up this number here, Rob, if you want to pull it up. The amount of lobbying that we do in America versus by industry versus other industries is not even close. If you zoom in a little bit, in 2024, leading lobbying industry by industry, Rob, I can't see the top, industry in the U.S., big pharma, 293 in millions. Then it's electronics. Then it's insurance. Then it's real estate, securities, oil, gas. Oil and gas is 1/3 of what we do with big pharma. So that validates it. But I guess maybe open it up, because one thing that you'll typically hear is the only two countries in the world that they allow for big pharma to advertise is New Zealand and U.S. We've heard about that before. How different is big pharma managed and handled in Europe, in the Middle East, Asia, versus the way it's handled in U.S.?
I would say very differently. I know Bob Kennedy personally. I met him for the first time 6 years ago. And Bob has many good ideas about how to improve the health of Americans. And one of his most important ideas is to ban commercials on prescription drugs, because we know that this is very harmful for the population. And not only that, it is also very costly for our national economies to allow all these nauseating TV ads on American television, for example.
Yeah, but how different is it in Europe, Asia, Middle East, South, Central America? Have you studied how it is done? Maybe even where you are right now. You're right now in, are you in Copenhagen? Are you in,
Denmark, yeah.
You're in Denmark. Okay. How different is big pharma managed and handled in Europe and Denmark?
Well, in one way, big pharma does business in the same way in the whole world. But as you said, it's only New Zealand and the United States that allows direct advertising of prescription drugs to consumers. So this makes a huge difference. And I believe we can see the outcome of this in national statistics. For example, the last time I looked at this, the United States uses 18% of its gross national product on healthcare. This is about double as much as we do in Europe. And part of this is because you have many middlemen in healthcare that we don't have in Europe, but also that you use drugs to an extreme extent in the United States, even very expensive drugs. And yet the net outcome of all this is that Americans have a shorter life on average than Europeans, even wealthy Americans. So it's not a question of some Americans being poor and not able to afford a good living. It is very much because of overdiagnosis and overtreatment with drugs.
And overtreatment of drugs. Yeah. That's not, disputable. That is the first thing they do when you go see a doctor. Hey, your kid's got a ADHD. Here's the medicine. Hey, I'm having a hard time, mental illness. Hey, take this medicine, take that medicine, instead of maybe you have financial issues, maybe you have family, maybe you have certain things that you got to address. So there's no question about who's doing it right. Is there a case study of a country where you've studied to say this country does it right, we should model after XYZ?
Well, the Nordic countries, Sweden, Denmark, Norway, Finland, and Iceland, they have actually been mentioned by US politicians as something that America should live up to. For example, we have a national health care where we take care of everybody. We don't need insurance that many people can't even afford in America. So the public healthcare system is I believe, very beneficial. And I can give you one example that comes from America. Quite some years ago, a very famous study was published that looked at over 3,000 counties in America. And that study found that for every 20% more family doctors there were in a county, total mortality dropped by 6%. These are incredible revelations, and I'll try to explain how can this be. Well, one reason is that a family doctor knows the patients they have. So they are not so keen to overdiagnose and overtreat as specialists are. They might be more reluctant to follow guidelines because they know that this particular person, in this case, it would actually not be beneficial to follow the guidelines. So they actually don't prescribe a drug that is called for in the guidelines. So this is one reason why it is of great benefit for a country to have very many family doctors and, so to speak, to keep the specialists at arm's length. But you do the opposite in the United States, so this is also a problem.
So we have more specialists than family doctors.
Well, I don't know your numbers. I just know that you focus a lot on the specialist rather than family doctors in America.
Is that because it pays better?
Well, I don't know what the reason is, but it would be beneficial for your population if you had more family doctors and fewer specialists.
Okay, so if we look at these numbers here, as of 2022, there were approximately 279,000 active primary care physicians, which represents 29.9% of all active U.S. physicians. This implies that 70% are physicians and specialists. So it's roughly a 3-to-1 ratio, a little bit higher. That 2-to-1 ratio, a little bit higher than a 2-to-1 ratio, 2.5-to-1 ratio, when we're looking at that. And Rob, if you can go back to the other number that you had that was interesting, the 2019 study with the 3,000 counties in the U.S.